है जी।
क्या है?
बस क्लास स्टार्ट कैसे पार्टिसिपेंट में
Picture. See,
पीआईटी से पार्टिसिपेंट
add the tool, add the.
जी।
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. Can everyone hear me? Okay, so today's lecture is about the foot muscles and its neurovasculature. It's a very lengthy lecture, but we will try to make you understand. I have made this lecture very concise and simple. Mm. Okay. So a bit of introduction of myself. I'm Dr. Zakir Alim. I've done my MBBS from KMC Peshawar, and I'm one of your demonstrators in forensic medicine. Okay, so the contents of what we are going to study today is the surface anatomy, the bones of the foot, the muscles which are in the foot, the nerves and the vasculature. So the surface anatomy, you can also call, is the identifications or the of the foot which you can find apparent. So the fibula is a subcutaneous bone which is followed down from the lateral malleolus. The medial malleolus lies about half an inch above the lateral malleolus. Now I think you might be known of the terms of the lateral and medial by now. Medial is towards the center, lateral is away from the center, towards the side. So the pulsation of the posterior tibial artery can be felt halfway between the medial malleolus and the heel, which is, you can say, over here. Okay, the anterior tibialis anterior tendon can be seen when the foot is dorsiflexed. Dorsiflexed is when you move your foot towards your face.
Excuse me, sir. सर जी
जी
हेलो सर जी
हेलो हेलो जी
सर 10 स्टूडेंट में सर आवाज जो स्लो रह जी
और स्लो है साज ठीक है
आवाज ठीक हो जी
The anterior tibialis anterior tendon can be seen when the foot is dorsiflexed and inverted, and the extensor hallucis longus lies lateral to this muscle, which is more prominent when the big toe is extended. Okay, the pulsation of the dorsalis pedis can be felt between the extensor hallucis longus and the extensor digitorum longus in front of the ankle, right here in the mid. These are all the surface anatomy structures that you can find on the foot. Posteriorly, the heel is formed by the calcaneum bone, and above this is the tendocalcaneus, which is also called as the Achilles tendon. The head of the talus can be palpated in front of the medial malleolus. This is the bone of the foot. The dorsal venous plexus is on the dorsum. Proximal to the toes, the great saphenous vein leaves from the medial part of the plexus and passes upward in front of the medial malleolus, while the small saphenous drains lateral part of the arch and passes up and behind the lateral malleolus. The peroneal tubercle of the calcaneum is 1 inch below and in front of the tip of the lateral malleolus. Medial sustentaculum tali can be palpated 1 inch below the tip of the malleolus. Okay, so what bones are there in the foot? They consist of 7 tarsal bones, 5 metatarsals, and 14 phalanges. You can divide the foot into 3 parts. It can be divided into the hind part, the midfoot, and the forefoot. It consists of the talus and calcaneus. These are the bigger bones. The navicular, cuboid, and the cuneiform bones is from the midfoot, and the metatarsal and the phalanges from the forefoot. So the talus bone, which connects to the fibula and the tibia articulation. This forms the articulation to the tibia and the fibula. Okay, the talus articulates with the tibia and the fibula above and the calcaneum below, right here. And at the front with the navicular bone. This is the anterior side. This is the anterior. This is the posterior. So in front of this, anterior, posterior. So the head of the talus is distally and has a convex articular surface with the navicular. The articular surface continues inferiorly. It rests on the sustentaculum tali behind and the calcaneoclavicular ligament in front. The neck of the talus posterior to the head, this area, and is narrowed. The upper surface is rough, which gives attachment to the ligaments, while the lower surface has a deep groove. Just below this is a deep groove here called as the sulcus tali. Sulcus tali and sulcus calcanei form a tunnel sinus tarsi occupied by strong interosseous talocalcaneal ligament. The body, this part, is cuboid in shape, superiorly articulates with the tibia. It is convex in front to back. From front to back, it is convex in shape. See, this is convex in shape. And slightly concave from side to side. From side to side, from this part to this part, it is concave. Laterally, triangular facets are present for articulation of fibula, and medially, a comma-shaped facet articulation with the tibia medially. So this side and this side, these joint and articulation is formed with the tibia and the fibula. Posteriorly, two tubercles are separated by a groove for the flexor hallucis longus muscle. This part. Calcaneum. The calcaneum, which is also called as the heel bone, it is the largest bone of the foot. This is the anterior part. This is the posterior part. The same goes here. This is the posterior, anterior. This is the anterior part, and this is the posterior. This is the top view when you look it from the top. This is the lower side view, and this is the side lateral view. The articulation with the talus is superiorly and the cuboid bone anteriorly. This is the articulation place for the cuboid bone. A projection from superior border of the medial surface called as sustentaculum tali, which is also the support of the talus, on the lateral surface has an oblique ridge fibular trochlea, which is also called as peroneal trochlea. Posteriorly, the prominence called calcaneal tuberosity, attachment for the Achilles tendons, which has medial, lateral, and anterior tubercles. This is the lateral tubercle, this is the medial, this is the anterior tubercle. These are the calcaneal tubercles. The medial tubercle rests on the ground when you are standing. This is the part of the heel which is on the floor. Now comes the midfoot bones, the navicular bone. The tuberosity of the navicular bone can be felt on the medial border of the foot, 1 inch in front. You can feel the navicular bone on the medial border of the foot 1 inch in front of the ankle, and below the medial malleolus, called the navicular tuberosity. It is a flat board shaped located between the talus posteriorly and the 3 cuneiform anteriorly. So anterior to this bone are the 3 cuneiform bones, and behind this bone is the talus. This bone gives attachment to the tibialis posterior tendon. You can see the articular facets for lateral navicular, articular intermediate navicular facets for the articulations. And this is the medial tuberosity, which we were talking about when you can feel it on the medial side. The cuboid bone. It is cuboid in shape. It is the most lateral bone of the foot. This one. Deep groove inferior aspect for peroneus longus muscle tendon. This has also articulation to the 4th and 5th metatarsals and to the cuneiform bone. You can see the 3rd and 4th and 5th metatarsals bones and the cuneiform bone. These are the attachment, the facets, and the articulation which has with these bones, and posteriorly with the calcaneum. The cuneiform bones. There are three in numbers. There are wedge-shaped bones. The first one is the medial, second is the intermediate, and the lateral bone. Medial is the largest bone, while the intermediate is the smallest. Each cuneiform articulates with the navicular bone, as we just mentioned in the last slide, proximally and distally with the first three metatarsals. Now, this is the navicular bone. 1, 2, 3. Here, this is the navicular bone, and these are the three cuneiform bones posteriorly. These articulates with the navicular bone and anteriorly with the first three metatarsals. Lateral cuneiform articulates with the cuboid. Cuboid bone. This is the cuboid bone, which is the most lateral bone of the foot. Metatarsals and the phalanges, which makes the forefoot. Metatarsals and the phalanges resembles the hand, metacarpals and phalanges, similar to the hand, having a head distally, a shaft, and a base proximally, numbered from medial to lateral. The first metatarsal is the largest and the strongest. There is a role in supporting body weight. The head of the first grooved on the inferior aspect. The head, the first metatarsal head is grooved because of the lateral sesamoid bones which are present in the tendon of the flexor hallucis brevis. The fifth has a prominent tubercle on its base, palpable laterally when you are barefoot. It gives an attachment to the peroneus brevis muscle. Each toe has three phalanges except the big toe which has two. I understand the ankle region has been taught by one of our colleagues, so I will skip this part. These are the joints of the foot. You can study this yourself. There is a chart where all the articular surfaces of capsule and ligaments are. Now we have the muscles of the foot. There are four layers of the sole which maintains the arches of the foot. Muscles individually are of little importance because fine control of the toes is not important. The layers of the foot are described inferiorly to superiorly. So the first layer is the one which touches the ground. That is the first layer of the muscle of the foot. So what consists of the first layer? It's the abductor hallucis muscle, the abductor of the greater toe, the one in the yellow, shaded in the yellow. This is the abductor hallucis. Its function is to abduct the great toe. Abduction, moving away of the bone or the joint from the body. Adduction, which is moving towards the body. The other muscle is the flexor digitorum brevis muscles. This one, the one in the brown. The flexor of the lateral four toes. These four toes' function is to flex these four toes and the abductor digiti minimi, which is the abductor of the small toe. This one, the one in the blue.
Hello?
Hello?
Sir, I was doing that slow, sir. We couldn't hear you.
Okay.
I was doing that slow, sir.
أسرة دي أص.
Sir, I was ready, sir, but slow there. There is that slow, sir.
Oh. So the first layer consists of these three muscles and the plantar aponeurosis, which has been cut over here. The plantar aponeurosis is the first structure which safeguards the nerves, the vessels, the muscles of the foot. It is basically a triangular shape, which is like this. I'm drawing this. So in red, the apex is on the calcaneum and the base fans out in the four lateral toes. So this shaded area is the plantar aponeurosis. So the second layer consists of quadratus plantae, which is also called as flexor accessoris, which is the flexor of the lateral four toes. This one, quadratus plantae. Tendons of the flexor of hallucis longus and the flexor digitorum longus. These are the tendons of those two muscles. This also takes part in the flexion of the toes and the lumbricals, the worm-like flexors of the proximal phalanges. The first part of the proximal, most first phalanges. Its function is to flex these phalanges and extensors of the middle and distal phalanges of the lateral four toes. This is the function of the lumbricals. This is the second layer, which is superior to the first layer. The third layer, which is superior consists of flexor hallucis brevis. This is the flexor hallucis brevis, which flexes the proximal phalanx of the great toe. Adductor hallucis, adductor of the great toe, which has two parts. And the flexor digiti minimi brevis. This one, which is an adductor of the small proximal phalanx of the toe, and also flexes the proximal phalanx of the small toe. This is the third layer, and the most deep layer, the fourth layer, are the three plantar interossei and the four dorsal interossei. The three plantar interossei, these three in the yellow, these are the adductors of the second to the fourth.
This is 0.00004%. General functions are put in the classification. The minerals are classified, Kenne's minerals are classified as the principal elements and trace elements. इसमें से दो अंटे classified करने किस तरह से आपको
The three plantar interossei, the adductors from 2 to 4, and the flexors of the metatarsophalangeal joints. The one in the yellow, these are the plantar interossei, which is below, and superior to this is the foot dorsal interossea, is the abductors of 2 to 4. From 2 to 4, these are the abductors of these metatarsophalangeal joints. There's also a mnemonic. You can use the plantar interosseous adduct, which can be used as pad, arises from a single metatarsal, and the dorsal interosseous abducts and arise from the second metatarsals. Pad and dab. You can memorize this by these. The two neurovascular planes, superficial plane between the first and the second layer of the muscles, and the second one is deep between the third and the fourth layer of the muscles. So there are 4 layers of the foot. This is the most deepest part. Here is another flow chart where you can find the muscles and their origin, insertion, and innervations and functions. The all layers of the foot have been described here. You can have it. You can have a look afterwards after the class. Okay, now muscles of the dorsum of the foot, the superior part of the foot. The extensor digitorum brevis originated from the anterior upper part of the calcaneum and inferior and extensor retinaculum. This is inserted by 4 tendons to the proximal phalanx of the big toe and the long extensor tendons to the second, third, and fourth toes. The nerve supplied by a deep peroneal nerve having nerve root of S1 and S2. This muscle causes the extension of the toes. And the insertion of the long extensor tendons. The tendons of the extensor digitorum longus passes beneath the superior extensor retinaculum, which is in the ankle area, and inferior extensor retinaculum with peroneus tertius muscle. This divides into 4, which fans out to the dorsum and passes to the lateral 4 toes. Each tendon is joined on its lateral side by a tendon of extensors. On the dorsum of each toe, the extensor tendon joins the facial expansion called the extensor expansion. Nerves of the foot. Yes, Gullu.
इंतजार कर रहे हैं पिछले 5 हफ्तों से उस मैसेज का मेरी सोशल मीडिया
Nerves of the sole of the foot. The tibial nerve with the artery passes behind the medial malleolus between the flexor digitorum longus and flexor hallucis longus tendons. This is covered by the flexor retinaculum. The tibial nerve divides into 2 posterior to medial malleolus, which becomes the medial and lateral plantar nerves. Here are the nerves. The medial plantar nerve, which is the larger of the 2 nerves, arises beneath the flexor retinaculum, runs forward and deep to the abductor hallucis, and runs anteriorly between abductor hallucis and flexor digitorum brevis on the lateral side of the medial plantar artery. So it lies to the lateral side of the medial plantar artery and between the adductor hallucis and flexor digitorum brevis muscles. This terminates near the base of the metatarsal, dividing into 3 sensory branches: supplying the cutaneous branches to the medial 3.5 digits. So this is the medial plantar nerve, and at the base of the first metatarsal, it divides into 3 branches, 1, 2, and 3. And this innervates the medial 3.5 toes. The motor branches to abductor helices and flexor digitorum brevis, flexor helices brevis, and the first lumbricals. The lateral plantar nerve. This one, the lateral plantar nerve. It is the smaller of the two nerves, rises beneath the flexor retinaculum, runs forward deep to the adductor helicis and flexor digitorum brevis with the lateral plantar artery. Reaching the base at the fifth metatarsal, it divides into superficial and deep. This is the deep and the superficial plantar nerves. The branches from the main trunk supplies to the quadratus plantae and abductor digiti minimi, and the cutaneous branches to the skin of the lateral sole. From the superficial terminal branches, it innervates to the flexor digiti minimi and interossei of the fourth metatarsal. Plantar digital branches passes to the side of the lateral first and 1.5 toe, extends onto the dorsum and supplies the nail bed, the tip of the toes. So this one here, it innervates the lateral side and also the tips of the toes above and the lateral side. From deep terminal branch, it curves medially, this one, it curves medially with the lateral plantar artery and supplies adductor helices, the second, third, and fourth lumbricals, and all the interossei except the fourth metatarsal, which is supplied by the superficial terminal branch. To the dorsum of the foot, the nerves, which are the saphenous nerve, which is the largest cutaneous branch of the femoral nerve, passes onto the dorsum in front of the medial malleolus. This is the saphenous, supplying to the medial side of the foot. This medial side of the foot till the head of the first metatarsal. Second is superficial and the deep peroneal nerves. The superficial peroneal nerve emerges between the peroneus brevis and the extensor digito longus. In the lower part of the leg, it then divides into medial and lateral cutaneous branches. This one, lateral branch, and here is the medial branch. Lateral branch and the medial branch. So this supplies skin of the dorsum of the foot, the medial side of the big toe, and the adjacent sides of the second, third, and fourth toes. Second, third, fourth. The sural nerve, formed by the union of branches from tibial and common peroneal nerve, which is coming from the leg. Sometimes they don't join, and there is no sural nerve. It enters the foot behind the lateral malleolus and supplies skin along the lateral margins and the lateral side of the little toe. This is the lateral side, the lateral margins, and this is the sural nerve. The arteries of the foot. The dorsum of the foot comprises of the dorsalis pedis artery, this one, dorsalis pedis artery. It begins in the front of the ankle joint as a continuation of the anterior tibial artery. This is the continuation of the anterior tibial artery, and which is formed the dorsalis pedis artery.
Excuse me, sir.
G.
Sir, आवाज दे that slow sir. दवा को पेचेट को इसका आवाज दे that slow sir.
Raji?
आवाज राजी को slow है सर. दवा को लुम पेचेट की गया सर वो आवाज slow है. आवाज पूरी clear है पूरा slow है. لكن
دي السلسلة ده فوليوم ده دي دغشته الميكروفون
دي سكو سمشت وتسا الميكروفون لك كلوز كيسر بيبقى المسلمة مثلا.
The dorsalis pedis artery. It begins in front of the ankle joint as a continuation of the anterior tibial artery. It terminates by passing down into the sole between the two heads of the first dorsal interosseous muscle, where it joins the lateral plantar artery and completes the plantar plexus. The superficial in position and is crossed by inferior extensor retinaculum and the first tendon of the extensor digitorum brevis. On its lateral side lie the terminal part of the deep peroneal nerve and the extensor digitorum longus, while on the medial side lies the tendon of extensor hallucis longus. The medial side is extensor hallucis longus, and on the lateral side the tendon of extensor digitorum brevis. The branches of the lateral tarsal artery crosses the dorsum of the foot just below the ankle joint. The arcuate arteries runs laterally under the extensor tendons opposite to the bases of the metatarsal bones, gives branches to the metatarsals, and the first metatarsal artery which supplies both sides of the big toe. Arteries of the sole of the foot. The medial plantar artery. This one is the medial plantar artery. Smaller of the terminal branches of the posterior tibial artery arises beneath the flexor retinaculum and passes forward deep to the abductor hallucis muscle. It ends by supplying the medial side of the big toe and it gives numerous muscular and articular branches and the cutaneous branches. The lateral plantar artery, larger of the terminal branches of the posterior tibial artery, arises beneath the flexor retinaculum and passes forward deep to abductor hallucis and flexor digitorum brevis. Reaching to the base of the fifth metatarsal here, the artery curves medially to form the plantar arch and at the proximal end of the first intermetatarsal space. From here it goes deep and curves like this. To join the dorsal-spurious artery, it also gives off numerous muscular, cutaneous, and articular branches. The plantar arch gives off plantar digital arteries to the toes. These are the plantar digital arteries to the toes. Veins of the foot. The dorsal digital vein running along dorsum of each toe are continuous with the dorsal metatarsal artery, which joins to form the dorsal venous arch and subcutaneous tissue. The dorsal venous arch communicates with the plantar venous arch. So this is the dorsal. This connects to the plantar, which is deep. Veins leave the dorsal venous arch and converge medially to form the great saphenous vein and laterally to form the small saphenous vein. This is the lesser or small saphenous. Now, saphenous. Medial and lateral plantar veins accompany the corresponding arteries and unite behind the medial malleolus to form posterior tibial vanicomatosis. Here are some X-rays of the foot. Normal X-rays. You can find all the bones. This is the navicular talus calcaneus, and these two are the sesamoid bones, small round ones. Some clinicals of the foot. Hallux valgus, which is the lateral deviation of the big toe at metatarsophalangeal joint. It is a common condition associated with badly fitting shoes common in women, often accompanied by the presence of short first metatarsal bone with time to osteoarthritic changes occurs in the metatarsophalangeal joint, which becomes stiff and painful, and then it's called as hallux rigidus. Second most common disease is the plantar fasciitis. Occurs in individuals who do great deal of standing and walking, causes pain and tenderness in the sole of the foot caused by repeated minor trauma. Repeated attacks induce ossification in the posterior attachment of the aponeurosis, forming a calcaneal spur. And the plantar reflexes. Deep tendon reflexes for neurological examination. The lateral aspect of the sole is stroked with a blunt object beginning at the heel and crossing to the base of the great toe. Flexion of the toes is normal response. The abnormal response is called as the Babinski sign, which is the slight fanning of the lateral foretoes and dorsiflexion of the great toe. We call this then positive Babinski sign, which is abnormal, indicating that there is injury to the brain or cerebral disease, and this is also normal in infants. This fanning out of the lateral toes and dorsiflexion of the greater toe. Thank you. That is the end of your foot lecture. You'll have to review your Nutter and Snell because this is a very lengthy topic